Welcome to Geriatric Core Principles. This is the module on elder abuse and neglect, a very important geriatric core principle. One of the concerns when we're working with caregivers is the potential for elder abuse and neglect. And one of the reasons it is so important to support our caregivers is that we're supporting an environment that helps them to provide that care without slipping into some of these other concerns. Elder abuse was first described in the 1970s in the medical literature. It was called granny battering initially, and it was defined in the Older Americans Act in 1987. We do break it into domestic abuse, so that's what occurs in the home or provided by somebody that individual has a personal relationship, and with institutional abuse or activities that will happen in a residential care setting. And we're going to mostly focus on the domestic abuse aspect in the conversation today. The definition of elder abuse, according to the National Center on Elder Abuse, is the intentional or neglectful act by a caregiver or other trusted individual that led to or may lead to harm of the vulnerable elder. It may also be intentionally targeting based on age or disability. And there are 6 different types of elder abuse that they describe in the literature. So we have physical, sexual, emotional, neglect, abandonment, and financial abuse. And important to recognize that oftentimes these don't occur in isolation. It's very rare that somebody is experiencing just one type of abuse or neglect. Most often these are happening in tandem with multiple other types of elder abuse. And it's very common. Estimates are that 7 to 10% of those over the age of 60 are victims of mistreatment over the last 12 months. And many of these cases go unnoticed or unreported, upwards of 1 in 10 to 1 in 23, actually. They do suspect that the rates are increasing. They show that in the literature. The question is it rates that are actually increasing, or are we increasing the reporting of it? In patients with dementia, this may be up to 50% of individuals are the recipients of some type of mistreatment. And it crosses races and ethnicities as well as sexual orientation. LGBT elders are very prone and at risk for elder abuse in their communities. Why do we care? It's not just a touchy-feely thing. This really does impact people's health and well-being. And the increased rates of mortality of up to 300% in those who are victims of elder abuse. It leads to loss of independence, increased risk of winding up in a nursing home prematurely, as well as hospitalization, and can lead to their functional and physical decline, psychological stressors, depression and anxiety, more treatment for more medical illnesses and symptoms, and higher rates of cost to our care. So many things that are impacted when a person is the victim of elder abuse. Healthcare providers are mandatory reporters of elder abuse and neglect. This is a snapshot of the language from the Ohio Revised Code, requiring that physicians, nurses, therapists, other healthcare providers are mandatory reporters, and it's going to be similar across the states in the U.S. In terms of screening, various organizations have different recommendations for routine screening for elder abuse in older adults. For example, the United States Preventative Screening Task Force does not have sufficient evidence to recommend for screening. However, the AMA, Joint Commission, and others do recommend routine screening in older adults. One way to bridge this gap in those recommendations, I think, is to really maintain a high index of suspicion and to recognize that many of these geriatric syndromes that we've spoken about, dementia, cognitive impairment, mood disorders, functional decline and falls, all of these may be the manifestation of elder abuse and neglect. And when somebody comes in who has exhibited these geriatric syndromes and they seem to be new, to make sure that we are evaluating and asking those questions on elder abuse to those individuals. And the questions are perhaps a little bit uncomfortable, but it is important to be direct when you're asking them. So asking specifically, do you feel safe at home, or is there anybody at home who is hurting you? Does your spouse, son, or daughter yell or curse at you? You can see here, these are very direct questions to ask, but it's important to be direct when you are asking them. And I would encourage you, regardless of your role on the team, to make sure that you familiarize yourself with these types of questions. We are all mandatory reporters, and it's important that we become comfortable in asking individuals these questions when the need arises. In conclusion, the care of older adults is multifaceted and often complex, and that's why it's important for us to rely on our team members in order to optimize the care plan for these individuals. Thank you for listening.